Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome, welcome, welcome. My name is Abby Tyler. I am your host. Already said that. How are you guys doing? Hope all is well. Today we are going to be talking about diabetes awareness. Are you at risk? Okay, so quickly, my disclaimer: I am a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your provider first. Okay, so without further ado, we'll get right into the topic here. So, diabetes. Okay, one a dreadful word, and a lot of people are afflicted with diabetes. So, this is a very in-depth topic. I'm going to try to make it no longer than 30 minutes. If I have to go out, just do part two. Okay, so alrighty, so good at diabetes awareness. So please, if you guys can share this broadcast, I really appreciate it. Again, some I don't have some of your friends, and we can change this because it's a real important topic. Okay, so let's get to it. So we're talking about diabetes awareness. For the purpose of this topic, we'll be talking mainly about type two diabetes. I will touch on a little bit of type one diabetes, but it's mostly about type two diabetes. So we'll be talking about your risk factors, symptoms, diagnosis, treatment, and prevention. Okay, so I'm going to be looking over my screen here in case if you see me looking back and forth. Okay, so type 2 diabetes, the stats on type 2 diabetes is like over 34 million Americans have diabetes. So that is about 1 in 10 people currently affected with type 2 diabetes. So people will say, what is diabetes? Must I you hear, I got sugar diabetes, I got this diabetes, I got sugar. So simply put, okay, the food that we eat every time, whatever it is you're eating, it turns into carbohydrates and it goes into your body. Okay, your body, I'm going to talk about a little bit of anatomy here. Your pancreas on your left side. Okay, the left side of your stomach's there, on your left side. Okay, the pancreas is one of the body organs that is supposed to secrete insulin. So when you eat that carbohydrates, you eat we eat the food, it turns into the glucose and everything. It goes into your body. All right. So the pancreas is supposed to secrete the insulin, which is an enzyme that's supposed to go along with the glucose, with the food that you're eating, and go into your body cells and create fuel and everything. And that works fine. Now, remember, I told you guys about the endocrine system when I talk about the thyroid and all of that. Okay. That's the part that controls all of that. So if you're going to see a doctor that about your diabetes, you'll be seeing your primary care doctor. And if you have to follow up with the endocrinologist, that's the person you go to. Okay. So normally your pancreas is also to make the beta cells, the cells that secrete the insulin and all that. When all that works, you take the food, you put it in your body, the insulin is secreted, you eat the food then digest, it goes into your body, you're fine. Nothing happens. It just happened like clockwork. You don't have to worry about it. Okay, but for some people, like people who are type 1 diabetes, those are the ones who are diagnosed when they're very young. Sometimes it's like 1 to 2 years old. Most of the time it's like maybe 3, 4, 5, and then later on in later childhood. Okay, when they're born, they don't have enough beta cells, and then eventually the body attacks it, and then just like none whatsoever. So the only treatment for those people, because they don't have any insulin to work with, for the body to work with, the only treatment for them is insulin from the day they're diagnosed to the day they is, unless if they have to do some other surgeries and all that. Okay. So it's only insulin. That's the reason why when people talk about diabetes and all, we usually talk mostly about the type 2 diabetes, but the symptoms are the same sometimes, but it's just that you get diagnosed, and they used to call that juvenile onset diabetes and all. Okay. So there's only insulin they get treated with. All right. Then for type 2 diabetes is you have your beta cells, your body is secreting the insulin, and that's working along with the glucose. Okay, so it's like you say in there, you're eating and the glucose like, okay, I go into the body, knock on the door, give me some insulin, we get our insulin, we go on, we're happy. As you get older, okay, sometimes it's most of the time is you get diagnosed like around maybe age 18, 19, because we usually start doing that and consider that adult onset. Okay, as you get older, your body, the insulin that is supposed to be secreting over time, it starts getting less and less and less and less. And you don't realize that until you start becoming symptomatic. And when that glucose start putting in your body, you don't realize that until you become symptomatic. And sometimes you don't find out until maybe you went to the hospital for something else and they did some blood work and they realized your blood sugar was, your glucose level was very high. Sometimes other things happen that you have to go look for something else. You know how we say you go to the hospital or you go to see the doctor for something else and then they find something else. So that's why some people don't like to go. But it's very important that you do go to the doctors to get checked, okay? Because it's one of those things like silent until it can become deadly if you don't get it corrected. And it can really hamper your life too if you don't get it corrected. Okay. So, like I said, it becomes symptomatic over time, and when that doesn't work, and that happens. So, some of the symptoms that you look for. Now, not everybody will have these symptoms, okay? And some of these symptoms also for type 1 diabetes. That's when most of the times when the family members start realizing that their child is having issues. Sometimes it's like they're passing out, or if it's really bad, they faint or something. That's when they find out they do the blood sugar and it's very elevated. Okay, so it depends on the kind of when you become an adult, mostly. All right, but it's also common in type 1 too. All right, so some of the symptoms, you start feeling very thirsty, more thirsty than usual. Like, why am I almost always thirsty? I feel like I have to drink some all the time. I keep finding myself drinking a lot more, even though I just drank. I feel myself drinking a lot more, and most of the time it's like water, not alcohol. Okay, so that's what we call polydipsia. Okay, when you're really thirsty, thirsty, thirsty. Polyuria is when you're urinating all the time. You're like, I was just in the bathroom and I urinated, pee for common words. And again, I have to go. It feels like I just go and I'm just going more often, more often, more often. Okay, that's polyuria. And then extreme hunger. You're eating more than normal. Everybody knows like what they eat normally. You're eating normal, but you're not gaining any weight, but you're eating every time you find yourself trying to much on this one, much on that one. And you said there's something going on. Why am I eating so much? And sometimes they'd be like, okay, well, maybe because I'm home, that's why I'm eating so much. Or maybe because it's not like to say if you went to a party and you ate a lot, but it's like you eating, you find yourself very hungry very frequently. Now, some people are just, what we call foodies, who are some people who like just kind of, we call healthy appetite. Okay. So you're eating a lot, but you're eating a lot and you don't find yourself gaining weight, but you just find yourself eating so much. That's called polyphagia. So we do the 3 P's. Okay. You find yourself losing weight even though you're not trying. Unexplained weight loss, unintentional weight loss is one of the things that we talk about. Now, remember, I also told you guys there's sometimes some symptoms and different kind of diseases, their symptoms can mimic certain things. So we're not just taking all these things in isolation. We have to look at all of it and look at your history and all that, okay? Because you can say, well, I had that and they found out something else. I had this and they find out something else. Okay. So like again, like I said, differential diagnosis that we go by. We will look at all the different symptoms, look at the bigger picture, and then come with a diagnosis. And if it's not it, then we move on to the next one. Okay. So when people say, oh, they were looking for this and they didn't find it, and they told me it could be that, they told me it could be this. No, we have to look at everything. All right. Again, going back to losing weight without trying, you got ketones in your urine because when you get your yearly blood work, which you're supposed to be doing, they find you and ketones in your urine out, and your body is breaking down the fat and it's emptying out in your urine. That's not supposed to be there, so we have to check on that. You start feeling really tired and weak. Most of the time, you're like, why am I so tired? Especially now, it's like, okay, why am I so tired? Do I have COVID? Do I have the flu? Do I have this? But this is like unusually tired and weak. Most of the time you find your energy that you had before, you don't have it as much, and it's like, okay, what's going on with me? There's something must be going on with me. Okay. You're very irritable, you're having mood changes. Like, I mean, you can snap just like that from being this person who was nicely quiet, and or somebody who was easygoing, and all of a sudden you just go from severe mood changes to severe mood changes, and it's a different pattern from the way you usually are. Blurry vision also. Okay. If that blurry vision comes on suddenly, please go to the emergency room. Okay, that's like we're talking about stroke there. So it shouldn't be okay. Every once in a while now, I can't see clearly. I find myself having to look a little bit more. That's part of the symptoms there. You have any sores on your body, and you notice that I had this sore on my foot for a while and it's not healing. It doesn't necessarily have to be on your feet, like anywhere in your extremities, your arms and legs, but anywhere really. And it's like it's just taking a little longer to heal. That's one of the signs there. Getting a lot of vaginal yeast infections. Okay, for women, vaginal yeast infection, you guys know what that is. All right. And for men, erectile dysfunction, because he might be saying, because that's why when men when I have male patients, they come and they would erectile dysfunction. I was able to like be able to sustain. I am having problems getting erected or having problems with maintaining an erection. Usually, we'll do testing, we'll do your blood work, and also check for your testosterone level. We'll check for your PSA level too to make sure you don't have anything going on with your prostate. And but then also be checking too, because that's all circulation issues. When your heart is not working okay and your sugar level is too high, that can also cause circulation issues down there too. So those are one of the things to do. The other one is anicostosis. I may be pronouncing this wrong. Nigricans. It's like on your skin. You look at somebody has like their skin color. Yeah, some people don't have the same color as their face and their neck, but that's different. You can see it's like really, really dark and velvety. Mostly you find that in African American people. So and it's like you feel it, and it doesn't feel like just okay, yeah, somebody's got different complexion, but it's like really feels like kind of thick and velvety on the arms. Sometimes it feels a little bit, yeah, it's on the shoulders. You start looking and be like, wait a second, that looks a little different from just regular pigmentation or hyperpigmentation. It looks a little bit more than that. So you want to bring that to your doctor's attention. Okay, so and hold on a second here. Excuse me. So that some of the symptoms to look out for. They can be more than that, but those are the main ones that we look at. So it's important also going back to the fact that you have to go to your doctors every time. You want to make sure you're going every year and getting your blood work, because the more we see that, the more they're looking at your A1C, looking at, we'll get to that later. The more they're looking at that and you're keeping an eye on it, it can tell you ahead of time if you becoming diabetic. And also we're looking at your family history. We're looking at the fact that your mother, your father, most of the time it's like first degree relatives, mother, father, and siblings. Sometimes it's grandparents if they have like really bad diabetes. Okay. So you're saying, so what are some of the causes and risk factors for this? Okay, so to understand, let me go in here. So some of the risk factors for this. First thing I'm gonna start with is race. Okay. So I'm saying in African Americans, all right, African Americans, black, Hispanic, American Indian, and Asian Americans are a higher risk. Remember, I'm saying higher risk. I'm not saying these are the ones that get it, a higher risk. Mostly, I mean, your theories out there. It could be like the your diet, it could be your the part of the world that you live in, because it's not just Asian people or African American people in America. Looking all through that, your environment, the pollutants in the air, also genetics that can cause that too. Okay, so a lot of Caucasian people have diabetes as well. So it's not just isolated to just these groups. They're just a higher risk of getting it. Okay. And again, genetics. You go to your first and second degree relatives. First degree relative mostly, and your mother, father, again, siblings. We go to that. All right. If you're overweight and obese, okay, obese also, because as you get older, naturally, or even when you're younger and all, but you guess you get older, your body's ability to be able to like lose the weight and all that is higher. So the more weight that you're putting on, especially if you're putting weight around your waist area, your stomach area, that blocks all the insulin from being able to work as effectively. So that can also put you at a higher risk. Also, people who are very thin. I have most, patients who like, if you're talking about, okay, Asian patients, most of them are very thin. So they also have a higher risk too. So it's not like, okay, yeah, you're obese or you're very thin because I'm skinny. So that means I can have it, or you're overweight, you can have it. It goes both ways. Again, going back to also genetics too. Okay. Obesity is the one that triggers the onset of the insulin, and it makes your body resistance to like the insulin and all that, the body's natural insulin. So that's why I can bring that up. Again, abdominal girth for men who have a lot of fat around their stomach, waist area. Women also will have a lot of fat around the stomach area. The body has to work harder to put that insulin out. Those who had gestational diabetes, if you were pregnant and you during the time you were pregnant, you go into your doctor every the way I think it's like every month for the first 6 months or so, or as often depending on your risk factors. And if you have gestational diabetes, chances are more than likely you may not need insulin after when you're pregnant, or they maybe give you something else. But then also after you have the baby, you may not need it any longer. But it just puts you at a higher risk of becoming stage two diabetic, not stage two, type two diabetic, as you get older later on in life. Okay. And also when you get pregnant, you have diabetes, that also puts you at a higher risk for uh outcomes can be a little poor, or you and the baby have to be monitored much closer because the baby can have some other complications too. Okay, sedentary lifestyle is what is important. You saw me; I've been putting my pictures up about exercising, and I understand quite. The older you get, it's harder to you have your work, you have your children, you have family, you have so many other things that keep you busy, that can keep you away from the gym. It doesn't necessarily have to go be in the gym, okay, but going out and going for a walk or doing things that would keep you very active, because you have many things that would keep you sedentary. Okay, and then sometimes as you get older, and in countries where people don't have, like, reliable transportations and different things, or you're working from the farm, you're doing things, you're walking around, you're playing soccer, you're playing football. The World Cup is on right now. I know that. And you're doing all that. So you keep becoming healthy, and you stay active and all. But as you get to places where you can do those things, and you can get in the car to go across the street, and you get all the availability of foods and all, you see that can put you at a higher risk, because then you're leading a more sedentary lifestyle. When you're not moving around, your body start picking up, you're eating all these food, and they're just piling up and raising your cholesterol level as well. Okay, I just went to, okay, high cholesterol too. If you have high cholesterol, all the food that you're eating, if you're not eating healthy food, that cholesterol piles up in your bloodstream, put all the little plaques in your body there. And if you all after extra high cholesterol, also makes it hard for the body to secrete the insulin in order for you to be healthy. Okay, and also for your age, most people who by age 45 is when we start looking at type 2 diabetes. But we've been seeing a lot of people recently, a lot of people in the past, like 10 years, 10 20 years, there have been a lot of people who have been diagnosed with diabetes, at the age 20, type 2 diabetes, age 20. So they're thinking that, okay, maybe could there has been this one, type 1 diabetes all along that wasn't discovered then, or it's just that because the fact that you live in an industrial society, or you live in a more developed society where the food, unhealthy food, and kids are playing, they're not playing outside anymore. There's barely any gym classes anymore. Most of the times they go to gym is like once a week or twice a week. Before, we used to be having gym like just about every day, and you don't necessarily have to do that anyway. And they have all the games, so they're not moving around. So most of them are becoming diabetics very early. When I see my patients when they come in and I do the test, and I'm like, okay, this is where you are. All right, you're too late, you're too young to be having numbers like this. All right, because the younger you are when you're diagnosed with diabetes, especially with type 1, also we're talking about that because they get the complications early. But even with type 2 diabetes, the younger you are when you get that, you're living with that insulin, and having to be depending on the outside insulin that it has to be given, need to be giving you, or the oral medication. You start having complications early. So it's better. The most important thing is to prevent it, or to try to delay as much as possible, even if you have it in your family. Just because your mother or father or your siblings have it doesn't mean you have it. You just at a higher risk, but you can prevent it and also delay as much as possible. Okay. So age 45, but by age 65, like nearly by age 65, nearly one third of all adults are diagnosed with type 2 diabetes. Okay. Like again, like I said, and when it comes to our community, Liberian community, we have so many people with diabetes. And sometimes when I go to a party and people are talking about diabetes, oh, I would just eat a little bit more of this, and I just take an extra medication. And I say, I don't say anything because it's none of my business, but I listen to the conversations, and it's like, okay, yes, you can eat extra food. Yes, you can take an extra dose of your medicine. By the way, you're supposed to be taking your medication the way it's supposed is prescribed. But there's some people who are on insulin, and it's called sliding scale. So based on what your blood sugar is. But if you're taking your blood sugar and it's running high every time, and you have to take extra insulin, then it's not being controlled the right way. You need to make your doctor aware of that. Doesn't mean you feel like something. Some people just have like the brittle diabetics. They do everything, but their blood sugar is just always high, and they have to keep adjusting the insulin and the different medications they take. Okay. So, and also another risk factor too is sleep. If you're not getting enough sleep, which is like as an adult, most of us don't get enough sleep. You talk about everything I talk about, social issues and your family and work and all. You're not getting enough sleep. So the stress hormone increases stress hormone called cortisol. So the cortisol is the one that keeps you awake and all, but at the same time it blocks it. It damages the production of the natural insulin. Okay, and that also keeps your blood sugar high and your blood glucose high. So when you get diagnosed, that's where it is. So that's why also when you're sick and you're already a diabetic and they give you steroids and all that also works in that. That also increases your blood sugar. All right. So let me just stop for a second there and see. Just realized I don't have my glasses on. Okay. Just gonna go in here. You guys give me 1 second there. Okay, so Augustine, what medicine is good for weakness in diabetes too? I'm going to get to the treatment in next slides there, okay? But thanks for watching. And River says, I'm at work, very interested in this topic. I'm feeling weak at work frequently. I think you should go get checked, River says. Go get your blood work. That's why it's important to get your blood work every year and as often as your doctor prescribes it. Okay. So how's the when you discuss all these things with your doctor? You say, okay, you come in with the symptoms, all right. Let's say you haven't been getting your blood work, or even if you're getting your blood work, and over time, some people, especially the younger ones, they don't come to see their doctors. Usually they'll see their doctor all to when they see the pediatrician because their parents make them go to see the pediatrician, and then they don't come again until maybe at least maybe 26, 27, or like 30, when like, oh, I'm getting older now, or something makes them come to see the doctor, like some other symptoms. So when they come in, we do the blood work, and we do all your other blood work, cholesterol level, we do your thyroid again, because like I said, that also affects that. We do everything else, and then we also include your normal blood work. So most of the time, there are other ways of doing that. So most of the ones that we find, we go by. Yes, you can do the you can do your A1C. That's the one, the glycosylated hemoglobin. That's we check that. Okay, that's the one we mostly go by, because you can do the fasting blood sugar, and your fasting blood sugar, we do that's supposed to be less than 100. That's why when we tell you to go get your blood work, we have you fast, because we check in that, and we also check in for your we check in for your cholesterol levels and all. So, but the A1C is the one, the glycosylated hemoglobin. That one is like the one that measures your blood sugar over a 3 month period. So some people might come in and say, okay, oh, I ate a lot of food last night, and I ate a lot of food in the past couple of days and all that. So maybe my A1C would be high. Most of the time, it would probably be your fasting blood sugar. But usually, if you don't eat anything like 12 hours prior to taking your blood work, your body hasn't had any food any in the body there, no glucose going on there. So usually, your blood sugar should be your fasting blood sugar, meaning nothing in your body for 12 hours. It should be less than 100. So we look at that, but some other ways we look at that. But most of the ones that we go by is the A1C, because we want to see what it's been over a 3 month period. Okay, so if somebody says they tell you your A1C is normal, that's anything below 5%, 5.7%, less than 5.7%, you're good to go. Eat healthy, continue to do that, especially if you have risk factors, your mother, father, again. So it's not saying, okay, you're free, you're clear to go. Just make sure you continue to eat healthy, because again, the older you get, okay, your risk factors, your favorite risk factor increases as you get older. Okay, so and then it will tell you you're pre-diabetic. Okay, you said they tell me, oh my, I'm pre-diabetic. You're pre-diabetic, meaning 5.7 to 6.4. Now, based on your risk factors, if you already have high cholesterol, and you have a strong family history, like let's say for stroke or heart attack or other things, your doctor will sit down with you and discuss. And at this point, they may decide, let's start you on medication. Okay, usually it will be your oral medication, meaning your tablet. Okay, that also depends on your kidney functioning too. So that's why we do all the other tests. So have all of that in front of us. So based on that, we say, okay, we have guidelines that we have to go by, but based on what the numbers are, okay, then we have to use our discretion, not just any discretion. We have to use a medical discretion stating that, okay, because based on his kidney level, so we cannot start this medication, but we can start him on something that him or her. Okay, I'm just using him. All right, so we'll tell you pre-diabetic, but that's and some 5.7 to 6.4. Now, also, if you're younger, I may tell you, okay, you want to keep you under 6. All right, so we go back. We'll check you again in 3 months. It's important that you go back in 3 months. But during that 3 month period, I need you to eat healthy. Okay, I need you to cut back on your snacks. I need you to cut back on your unhealthy snack. I need you to cut back on your rice if you eat a lot of rice, because some people eat a lot of rice at one time, or some people eat rice for breakfast, lunch, and dinner. Okay, or they eat whatever their natural food is that has a lot of starch, and natural food like their regular food. So it's like, okay, so you have to cut back on that. Put a lot more fruits and vegetables in it. You don't have to eat salad if you don't want to, but if you can eat salad, if you can put a little bit there, it won't kill you. Don't put every animal in the zoo, put it in the food there. If you're gonna do that, cut back. You can eat some buni. I'm talking about mostly Liberian food now. You can eat some buni. You can eat make the dry fish, dry chicken. Stay away from fried food. Stay away from fried food. Stay away from fried food. Stay away from over seasoned food, because sometimes you eat some people food and it has so much salt in there. That salt, and also if you have high blood pressure, that also affects your kidneys, and also affect the fact that your body has to work hard to secrete that natural insulin, and you may need to keep getting more medication and adjusting more to that. Okay. So at that point, like I said, based on your risk factors and other things, they're looking at your age, your race, and all. Your doctor might say, okay, let's start you on some medications right now, and we're going to be checking your blood sugar. We're going to be checking your A1C every 3 months to see where you are to keep you there. Okay. And some people, even if you tell them, okay, I'm looking at all your risk factors, and I'm saying that you need to start the medication, you might say no. Okay, I would say, okay, fine. All right. I'm telling you what the risks are now because you have other things I'm looking at. I'm not just looking at that number. We don't just treat you just by the number. Okay. And I can say, okay, then this is it. We'll do your blood work again. And sometimes they come back, the numbers a little better. Sometimes they come back, the numbers like way worse than what it was. Okay. So that's why it's important to come back every 3 months when it's out. We're not just doing that to take your money. We're making sure you're safe. Okay. And then when you get fully diabetic, and it's like 6.5. All right. So anything something in 6.5, and that's when he's like, okay, you are diabetic. All right. This is when you actually literally have to start the medication. Again, some people may also say, you know what, I read this here and I did this and all that. The risk is totally up to you. We tell you everything. Okay, so you need to, okay, we start you on a medication. The first one, I don't go too much into medications when I talking yet because again, we really tailor everything to your care based on your risk factors and the numbers that come back to us. Because again, we're not just looking at your A1C, we're looking at everything else that comes along. Okay, so but we're first thing we do, we start you with the pills. Okay, there are many medications out there. There are other medications now that come out where you can do the insulin. They tell you took the insulin based on your blood sugar, breakfast, lunch, and dinner. And your doctor's office will teach you how to give the insulin and all that. We also have medications or injectables, so it's not necessarily insulin that you can take it once a week. Okay, and that also helps your blood sugar and also protects your heart because the most important thing when you have diabetes and it's not controlled, you have all these other risk factors, all these other complications. Okay, so we combine the medications together. We can put you on one medication. We can put your insulin that you take once a day, insulin that I take 3 times a day, and other medications that go out there. Most of the thing is to protect your heart, also protect your kidneys because over time diabetes also affect your kidneys. So your provider will sit down with you and discuss all your risk factors and tell you which medications will be best for you. Again, that's why I say it's really tailored to your care because you may come in and say, oh, why don't you give me this medication? Oh, I saw this medication on TV and it's out there, and I was watching this commercial and it said I can take this. Okay, you come in and you have family problem that you have thyroid issues before, or somebody had thyroid cancer that's very close to you, a first degree relative. We can start you on that medication. And some medications right now, they also help you lose weight too. Some diabetic medications can help you lose weight as you exercise as well. So it's not just giving a medication, you're going to lose the weight. Okay, so all of that, the doctor will tailor it to your care. The most important thing is to making sure you're getting your blood work when you're supposed to get your blood work, when you get diagnosed, and if you get diagnosed when you become a diabetic, and the good thing about type 2 diabetes is totally reversible. Okay, you can literally take your medicine, eat healthy, and work your way all the way back to being and not diabetic or pre-diabetic, where you don't have to take that much medication anymore. It can just be diet control. But depending on the time, what your numbers are when you're diagnosed, it's not something to say, "Oh yes, I'm just gonna eat healthy, and then my numbers will come down." Oh, I don't need any medications right now. Some people, when you do their medication, when you do the lab work, the first time the lab work is done, their A1C, I told you to be diabetic is like anything greater than 6.5. Okay, some people, their A1C, when you do it, it's like 12. You can't be walking around with an A1C of 12 or anything like even like greater than 9 because after 9, you're supposed to be starting on insulin and stuff. You can't be walking around with that because eventually you're going to have a heart attack or a stroke. So it's very important where you are when you get diagnosed will determine the kind of test the treatment your doctor would decide. Okay. So let me go in here. I don't see any questions right now, so I'm just gonna go. All right. So you want to make sure that you're controlling that, and also your doctor will tell you, okay, they will give you all your supplies. They will tell you how often they want you checking your blood sugar, and usually when your numbers are high, will tell you keep a whole log of it. Take your blood sugar maybe twice a day. Keep a log of it, and when you come back for your appointment, you bring it, and you can copy that and scan that into your chart. Okay, so we're looking at the numbers, and based on those numbers, and also when we do your A1C, we can kind of regulate the dosage or the kind of medication we're giving you based on the number, and also based on your kidney functioning, based on your liver functioning, based on your cholesterol, and everything else. We're never just treating just the number; we're treating the entire person. Okay, so if you don't, and the thing about diabetes, they're so the complications that come along with it. So, what are you taking good care of yourself? What are you following all the different things you're supposed to be doing? Or some people just unfortunately have complications. That's why it's important to also take that. So, in addition to your primary care provider, you're going to be seeing other doctors too. The most important thing, the diabetes. Okay. It also hardens your arteries and all that can lead to cardiovascular disease, which puts you at a higher risk of having a heart attack or a stroke. That is why when you are diabetic, we tell you which what we want to keep you under 7. Okay, try to keep you safely under 7. So aim for under 7. Remember, I told you it's like 6.5%. That's the highest. That's your diabetic. So you want to keep you under 7. And if you can work on your way back down, fine. But you want to keep you under 7. So if there's anything, we might send you to the cardiologist so you can get your cardiac workup. They might do stress tests. They might do an echocardiogram to look at the functioning of your heart. EKG, look at your heart rhythm, and do some other testing to make sure everything is fine. All right. So it's important that if you do take your medicine and you start having, having chest pain here and there, little twinges in your heart, and you feel something else, make sure you bring that to your doctor's attention, because that could be a sign of complication, and that could be something very scary, dangerous, that you don't want to ignore. All right. And nerve damage, because all over, and when it destroys the big arteries, the big blood vessels and all that. It also destroys the smaller ones. So you start having numbness and tingling in your hands and feet, and you're like, okay, wait a second, why is it my feet are burning all the time? Why is it? And so that's why it's also important that also looking at cholesterol level, and doctor might put you on some aspirin or something else based on what they see. All right. And then for your toes and all, it's important that when you're walking around, you're not walking, you're supposed to look at your feet every day. Take the mirror, hold it up to your feet, look at it real clearly, making sure that, because if you're walking around, you're on your barefoot, and you get cut, that circulation is already decreased going down to your feet because of the diabetes. So if you get a cut on your foot, that can take forever to heal, or that can be in something that you don't notice that is there, because you lose the feeling eventually to your feet, and that can stay there for a while. And next thing you know, that whatever's going on there, they're sore and everything's coming up, and it's getting worse and it's worse. And diabetes is like the number one reason for not traumatic amputation, meaning that when it becomes to where they have to take your toes off, and they start taking that one foot and it start coming up to the knee, and before you know it, you lose a whole limb. And it also travels to the other side. So it's very important that you see the podiatrist every year to get your feet checked. You're supposed to be checking your feet yourself, and then also seeing a podiatrist every year and looking at your feet just about every other day. Don't walk around barefooted. Okay, that's what also in like where countries are in developing countries, where it's like you don't have access to adequate health care, and some people walk around with like inadequate shoes covering on the feet. They have a higher risk, and then when they get sick or something happens, they have a higher chance of dying or losing their livelihood, because now they can no longer work because they have this thing going on the feet, and you don't have all the different people that the different specialists to take care of them. So making sure you go see the podiatrist every year, and going to get your pedicure is not the same as going to see the podiatrist. You can still do both. I would suggest that you see the podiatrist. The podiatrist will tell you whether you need to get a pedicure, because what if they're doing your feet and doing stuff and then cause little cuts here and there? You want to make sure you check your podiatrist first. That's the foot doctor. All right. It also can cause kidney damage, like I said, when I talked about, high affects your kidneys and all. And also some of the medications also affect your kidney. But it's either we do the risks and benefits. Do you need a medication more than you need that? Okay. So we're based on that. That's why every time you have to come back and get your blood work done, so we can see where the numbers are. We can say, okay, maybe we need to change the medication based on what the numbers are. And it gets to a point where we have to do some kidney testing too. You have to see the nephrologist. That's the kidney doctor at least once a year. So you see why it's important, when you see how really detailed and involved this disease is, that you have to have all these specialists working along with you. Okay, you can say, okay, I don't want my life to be this involved. I just want to be able to do my thing and all. It's important that you do that. It's important that you eat healthy. It's important that you exercise, so you prevent it and delay all of that, because yes, it does take a toll of your life, but most of the time you're just going, once a year. You can basically sit there and say, okay, today's December. I'm going to see all my doctors. Hopefully everything will work out, that you can see all your doctors in one day and be done with it. Okay. But of course, if you have other complications that you need to be seen more often, then that does take a little toll on your life, but that also supposed to help you live a healthy life. All right. And after a while, it also damage your eyes, the blood vessels. That's why it's important that the blur vision, like I talked about before. And over time, diabetes is also one of the number one cause of blindness. Okay. Adult blindness. And if you have type 1 diabetes, again, these complications come a little earlier when you have type 1 diabetes, because you've had to live on an insulin for so long and your body had to go through this for so long. Okay, so it's called retinopathy. So you want to see your eye doctor once a year, every year, once a year, every year. Okay, it's not just, all right, I don't want to see, once a year, every year. You are diabetic. Even if you're not diabetic, you have high blood pressure and other reasons, you need to be seeing an eye doctor. But especially if you're diabetic, you need to see an eye doctor, because you don't see these changes coming until when it gets too like worse, and then you like, oh my god, I didn't know this was like. So you need to see them every year so they can see you. And sometimes the eye doctor might say, let's see you a little bit more often, and then we'll see the progress of what's going on. Because remember, some people are gonna also, it takes a long time to get diagnosed. Some people don't want to go and they don't get diagnosed until incidental, when they go somewhere to the hospital or somewhere and then get diagnosed based on what they saw when they went for something else. Okay, so you see those people, you see the ophthalmologist, you see the nephrologist, and you seen the heart doctor and all the cardiologists and all that. And you may have to see a neurologist too for the neuropathy, like numbness and tingling in your arms and all, and making sure if you have problems with, you have family member that has stroke before, they need to follow up too. Okay, so that's very, very important. Okay. So for skin conditions, you'll be prone to different skin problems. So then you have to use different kind of lotions that also affect your hearing. And you see your family doctor, are they checking all that? You may need to see an ENT. And sometimes diabetes, especially type 1 diabetes too, because you have a child that's living with this for a very long time. And especially when they get to like in the teenage years, they don't want to be different from their friends. They don't want to be getting shots every day. They don't want to be, because they can only take insulin. When you have type 1 diabetes, you can only take insulin forever. Okay, so it's like they don't want to do that. They just want to be with their friends. They want to hang out with their friends. And that's when they run into problems, because if they're not taking insulin that they're supposed to, then you go to their room and they're laying there and they're passed out, or God forbid, they're somewhere in the street and they're driving and something happens. Okay, so it's important, and it can bring on depression. So they have different support groups that you can go out there, and the groups in your area, groups online that you can talk to people who have it. You can talk to your doctors. Your doctors have their social workers, and also for your insurance company, to your insurance company, and you provide social workers for you to talk to, care coordinators that can call on the phone and talk to you about it. All right. And if you don't take care of that, if you're not treated, and you're not doing it the right way, anything, heart attack that can lead to death, or stroke that can lead to lose your livelihood, lose the way you live your life, and also death. I'm not trying to scare anybody. It's just very important. It's very, 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 very important. Okay. So we will move on to, let me see the time there. Okay. So prevention, type 1 diabetes cannot be prevented. Unfortunately, it's an autoimmune disease. Okay. So I told you autoimmune is like in the body sees something that's supposed to be there and it attacks it. They don't know the different mechanisms that cause autoimmune diseases. That's still so the different theories that's going on there. Some kind of genetic mutation or whatever it is, it attacks it and it just takes away all your beta cells. You cannot secrete the insulin. So that's something that you have no control over. So there's no way you can prevent that. And that can also be hereditary too, because that can be passed on. All right. But the most thing you can do, healthy lifestyle. Again, like I said, eat healthy food, low in fat, do the best that you can. Okay. Eat a lot of high fiber foods, apples. You can have a lot of fruits and all that. That can take that. Back in the day, we used to eat our plum. We used to eat our, mango, German plum. I haven't had German plum for so long. And we ran when we played outside. We did a lot of things and all that. So it's like you were healthy then. Try to do that again. Okay, as much as you can. I know sometimes some places it's hard to find, depending on where you live, it's hard to find healthy foods, and some people have the supermarkets are so far from where they live. That's what we call food deserts. Okay, so they have to travel 2 buses to get to this place, travel to, so chances are more than likely they're going to be getting food that's like right on the corner store, which is unhealthy. Okay, if you eat rice, try to cut back. You don't have to eat it every day, or you don't, the portion that you eat, you can sit there. At one time I had this little plate, I showed it on where I put the plate up where different compartments where you can put like your soup and different things. And somebody said, yeah, like people, they're just gonna fill a whole three compartment with rice. So I mean, it's our staple, so we gotta eat it. But and also, it's not just okay. A lot of people eat rice. It's not just like you're people that eat rice. It's like a staple for many people. So cut back on that because that. And if you eat rice, you can eat some brown rice. You can mix the brown rice with the white rice if you don't like the brown rice. Okay. Eat a lot of fruits and vegetables. Try to get up and move around as much as possible. Exercise 30 minutes a day, at least 3 times a week. It doesn't have to be in the gym, but you can move around so you can get the heart rate up and keep yourself healthy. Of course, you want to talk with your doctor first and make sure you're healthy enough to do that. But it's important that you do that. All right. As I already said, get the physical activity. Try to lose some weight. If you're overweight, try to lose some weight. I'm not married to the BMI. Like people say, oh my God, my BMI is like so high. So it's one of the tools that we use so to measure your weight and all that. But don't say, oh my goodness, my weight is so high and it's this. And then some people also, the heavier they feel, the more uncomfortable to feel go into the gym or uncomfortable going to go buy clothes to exercise. And what would people say about me if they see me out there and I'm on this and I'm exercising and I don't want that. And again, like I said, as women, as we get older, your hormonal changes, you're going to gain some weight over time. Some people don't. Some, if you're naturally skinning or other things like that, some people don't gain it. And just because you gain weight doesn't mean you're just eating healthy and you're unhealthy and you're lazy and you're this and all the different stereotypes that come along with being overweight that will keep people from getting to where they need to be healthy. Okay, people will say things to you. People will say things behind your back what you hear clearly, or and don't read those comments. Don't read those comments so many times. It's like people put things out there, especially on public pages where people say stuff. People say stuff to me too when I went through that early this year, and people say stuff. And sometimes I look at myself, I'm like, oh, you know what? A couple of years ago, or like maybe 20 years ago, I used to sit there, eat anything I wanted, and not gain a single pound, and I was just like this skinny little thing. I see my pictures from like 20, 30 years ago. I was like, and then it's like, okay, this is where I am, or this is where I am. You have to be happy with where you are in life and all that. Okay. It's hard to get to that point where you say, okay, this is the way that I am right now. And I used to be skinnier and I used to be this and all that too. You have to accept that in order to get to the point where you can exercise more. Okay. And keep yourself healthy. Just because you're overweight doesn't mean you have diabetes or just, and again, I'm going back, overweight or underweight. You can also not underweight, but like skinny, you can also be diabetic. All right. So just do the best you can. Do the best you can. Don't get yourself all worked up over it. Okay, so I talked about the treatment, and I said the treatment will be based on, it'll be tailored to your lifestyle, based on your lab level, based on all your other risk factors too. Okay, so the most important thing is it's committing to, make sure you commit to it. They tell you have diabetes, make sure you commit to it. Manage this is something that is ongoing that you have to really control all the time. Okay, don't let it take over your life, but at the same time, don't be slacky about it. Make sure you commit to the treatment that your doctor said. Take your medicine that way. If you have any side effects on the medication, bring it to your doctor's attention so that way at least they can change your medication around. Don't just stop taking it. Okay, because usually we document, take your medicine. If you have any problems, bring it to our attention. And there are ways that you can take certain medications. That the medication, you have to take it, and it causes some diarrhea the first couple of times until your body gets used to it. You can do it away. There's so many different devices now where you don't have to stick yourself every day. You just take your phone and check it on your arm, and you get your blood sugar right there. And some people have the insulin pump they put into the body where it secretes the insulin when they're ready. Also, again, like I said, other things where you do it once a week and you're done. You don't have to be sticking yourself every day, and it controls that and also helps your body, help your heart disease to help prevent that and help your kidneys as well. Okay. So make it for so is, and once you have it, you have your whole family. It's a whole family thing. All right. You can have grandma, you can have mommy having diabetes or daddy having diabetes, and you're sitting there, you're eating your whole bowl of pumpkin rice, and you tell them to eat salad. That's not gonna work. Okay, so no, 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 no. You can eat the salad too. Eat a little bit of the pumpkin rice, but eat the salad also because you want to make sure that salad is going to create that roughish and fiber and all that with your fruits and vegetables to get that thing out of your body as fast as possible. And don't eat late at night. I know for most of us who work hard, who work later on the day, you eat and then you go sit down, and that's hard. For me, I told you guys, it's hard for me to work during the workout during the week. So like Friday, Saturday, and Sunday, and sometimes Monday, I exercise 1 hour each day. So I'm getting my, at least my 30 minutes over, so like 4 hours in one week. And I do that. And then during the week when I'm not exercising, I do my stretches and I have my dumbbells too. And I do that just to keep myself busy during the week. Okay, so I mean, it's a whole lifestyle change, and identify if you having anything where tag that says I'm a diabetic on there, because sometimes you'll be laying down somewhere and you see them pass out and you're thinking, okay, that one's a drunk on the street, or that one is that, and not knowing that blood sugar is really low. Always have your medicine with you. Have some healthy snacks with you. So if your blood sugar is low, making sure you're taking that, so you're not just sitting there. If you come upon somebody and the person's unresponsive, please call 911. I saw this video one time where this person was unresponsive and this lady was talking Nakara, and I prayed for her and I prayed and I prayed. I'm like, no, call 911. Yeah, you can pray as they're taking her. Why somebody you got minutes away from that person could be having a stroke, a heart attack. And I did not say you shouldn't pray. Call 911 and then get the person to get help. So it's important that you have that, okay? And then, pay attention to your feet. I said all that. Get your vaccinations. The most important thing. When you have diabetes, you have a higher chance of getting easily infected. So making sure that you up to date with your COVID vaccine, up to date with your flu vaccine, and your regular vaccines for depending on your sex, depending on your age and all. Make sure you keep your vaccines up to date. Making sure you go to the dentist too. So make sure your teeth and your gum are healthy. And if you smoke, please try quitting smoke. It's 1-800-QUIT NOW, or you can go on there and any nicotine site and find the smoking stuff there. If you drink alcohol, please cut back on your alcohol. All right. And your stress level, please. I know it's hard. But make sure you watch your stress level, because that's so important. Again, like I said, your stress level, that releases the cortisol, and it makes makes it very difficult in order for your body to respond to the insulin. Okay. So please make sure you do that and take care of yourself as much as possible. All right. I know I went a little longer than I wanted to, but I just wanted to put that out there. So diabetes, you can manage it. And the most important is try to prevent it. Type 2 diabetes now. Try to prevent it or try to delay as much as possible. And also, and if you do have it, try to take the medications like you're supposed to. Be very, very intentional about your medication you have. Like, again, let's commit to it. Commit to the treatment that you need to have. Okay, watch your feet. Every time, look at every other day, making sure if you see any kind of cuts on there's something that looks a little different, and it's on the dark spots that look a little different that it wasn't there before, bring it to your doctor's attention. Go see your podiatrist and every year like you're supposed to, or as often as they want you to. Make sure you see an eye doctor. It's not just for the glasses and all. They may need to change your prescription, because over time it does affect your eyes, and it can also lead to blindness. So blindness and amputation of your limbs, those are the things that we want to prevent. Okay. And the older you are, the older, especially you over 65, we don't try to like manage your diabetes. Like, so we're not so strict on it. So if you say, oh my God, my mom is like 80 years old and her A1C is like, maybe by then 7 and it's 7.5, and we're supposed to keep it lower than that. No, we don't stress on it too much. As long as we try to keep it 7, 6 and all that, as long as you're taking the medicine, because most of the times you already have other pre-existing conditions, and also we're not going to go be so strict on you when you're 80 something years old. Of course, we want to make sure that you staying healthy when you're 80 something and 90 years old. I know a lot of people who are like 80s, 90s and all, and the quality of life. So not saying, because you're that way, so you don't need to be healthy anymore. You want to have a healthy quality of life for as long as you can. All right. So, and that's pretty much diabetes in a nutshell. Is not everything that comprehensive. There's much more, and that I just wanted to make sure and bring that, give you the baseline, so you can take that and go to your doctors and say, oh, you know what, somebody talked about diabetes yesterday, and I know I haven't been here for a while. Oh, by the way, can you just tell me what my A1C was? When you check my labs and you call me and say, oh, my numbers are fine, can you tell me what my A1C was? Tell your doctor, what's my A1C? Because I know I'm supposed to be on less than 5.7. So, but if it's over than 5.7, what's my number? And why aren't you giving me any medications again? Can you please explain to me why I'm not on any medication? Can you explain to me when I'm supposed to start insulin, or there are other different treatments I can get? She did mention something about different treatments based on my lifestyle and based on my risk factors. Can you please tell me other things? So you take this and then take that as a baseline to talk to your doctors about it. Okay. And also you can use the Mediterranean diet out there. As with us, we have to season our food in certain ways, so you can incorporate all of that. The DASH diet, it's called DASH. Look online. DASH is dietary approach to stopping hypertension. You can go in there and incorporate that into your local foods. So I'm not telling you stay away from your food that you've been taking forever. I'm not saying this person food is bad, because even when I talk to my Asian patients, I talk to my Hispanic patients, I talk to my white patients and all that too. I said, what kind of food do you eat a lot? And then I try to tell them, okay, you can find a way where you can move it around a little bit, where you can still enjoy your food, but at the same time, you don't want to overdo it to where you're going to cause yourself harm later on. Okay, the most important thing, again, want to prevent those complications by making sure we're complying with our medications and also following up with all these different specialists that you're supposed to. Okay. So I don't see any more questions, and I hope this video was a help to you or to a family member out there. I know it seems a little bit overwhelming, but it doesn't have to be, as long as you follow the things that you're supposed to follow. Okay. And also, like I said, any side effects, bring it to your doctor's attention. Don't just stop taking your medication. All right. So I hope this has been good for somebody out there. I'm sure somebody will benefit from it. Please give me a thumbs up or a like, please, please, please. Please share this video as much as you can. Let me just see if there's any more questions. Jackie Jackson said, great topic, Abby Tyler. Thank you very much, Jackie Jackson. And Allison, you know what? Sorry, I have to put my glasses back on so I can say your name right. Okay, Allison Saba say thank you. Thank you. Thank you for watching. Okay. And you guys, if you have any comments or questions and all, just leave it below. I always go through the questions later on and I can respond to it. Please share this video as much as you can, because again, we don't have the same kind of friends. So other people can get to see it too, and also hopefully get some help from it. Okay. So I thank you all for watching. Again, please give me a thumbs up. Please, please give me a thumbs up. If you haven't liked and followed the page here, please like and follow. Also, please invite one friend. If each person, I have like about 700 followers right now. If each person invite one person, I could get to my 1,000 by December. Okay, but I thank you all for watching. Okay, I hope you all have a beautiful night, a beautiful morning, depending on what part of the world you are when you watch this. And I will talk to you all later. Please stay safe out there and take care of yourself. Thank you for watching, and thanks for your support.